everyone, welcome back to my channel. So today I have a review of another, holistic, integrative, alternative medicine clinic. This one is actually here in Los Angeles. And I do want to start off by saying that I took a long time to decide whether I wanted to do a review. I actually haven't even written an online Google review. It's been over a year that I went to this clinic, and there's a reason why I've been thinking long and hard about this, and I'll address that in the video. But right now, with all of the, all of the RFK stuff, as some of you know, RFK is now our Director of Health and Human Services. And, you'll see how it all ties into this. But because of that, I believe that this review is going to be much more timely. I also had to go through, some of the paperwork that I signed, because when you see doctors like this, you sign a lot of paperwork, and I'll go through the paperwork I had to sign. And I wanted to make sure that I was legally able to make this video. To be honest, I don't think doctors, barring certain, lawsuits or things like that, doctors can't really bar you from leaving a review for them online. But we'll talk about that as I go through this video. But I just want you guys to know that I had to sort of double check and make sure that I could speak out, because I think there's a lot of misinformation floating around about this particular doctor. So, last year, so right now we're in 2025, as of the making of this video, it's April, the middle of April, 2025. I went to Regenerative Medicine, LA, to see Dr. Mark Galili. I believe it was January of 2024. So like right at the beginning. This was around the time that I had ureaplasma. I was prescribed a fluoroquinolone antibiotic. And I was really concerned about taking it because I already have a lot of health issues. And so I started freaking out because I wasn't sure how my body was going to react to it. I've heard a lot of bad things about fluoroquinolone antibiotics. It should be common knowledge at this point that they can cause a lot of like issues with your tendons, but also something called fluoroquinolone toxicity. And I have made a video on that if you guys want to see that. But Dr. Galili actually suffered with fluoroquinolone toxicity many years ago. I think he was like just a new doctor at the time, or he might have been in medical school. I can't remember. His story is online somewhere. And, he had to take a fluoroquinolone for something, and then he ended up with fluoroquinolone toxicity. He ended up in a wheelchair. He just wasn't able to function the way that he did before. And like many of us that have had these weird responses to medications or, to an illness, it completely changes your life. Fortunately, because he was a doctor, he, did some research, came up with a protocol, and was able to rehabilitate himself, I think, in less than a year. Now, a lot of people are going to question this story. I questioned it myself. But I guess I have no reason to believe that he would lie about something like this. But, I'm going to say this right now. Suffering for 6 months as opposed to 6 years is a very, very different it's a very, very different game, let me tell you. So he may have an understanding of those of us with chronic health issues, and how bad it can be. He knows that it's real. But, if you've only been suffering for a short period of time, I don't think you really know the reality of how difficult some of these conditions are to treat. That's all I'm going to say about that. I'm not saying that he doesn't know what he's doing or, whatever. I just, had he been sick for longer, I think he may have been more empathetic to people that have these long-standing chronic conditions. And by the way, fluoroquinolone toxicity lasts years. Typically, it lasts a long time. If indefinitely. Some people, a lot of people do recover from fluoroquinolone toxicity, or they regain a lot of their function, but it does take years from what I've seen. So I found Dr. Galili through the Reddit, the fluoroquinolone toxicity, I think it's called Floxies on Reddit. Probably one of the best Reddit groups for like a chronic condition or a health issue. It's very comprehensive. The people there are very helpful. The moderator is great in that group. And so I saw a lot of talk about Dr. Galili. He is in the Los Angeles area. I live in the Los Angeles area. So I thought this is, very convenient. I can go and see him before I start this fluoroquinolone because I was really, really worried about taking it. And, and the Reddit thread is very, very informative. It's very helpful if you are going to take a fluoroquinolone, or if you've already taken a fluoroquinolone, or if you have toxicity issues. They're really great. I would suggest going there first before you actually, this is not good advice, but I would suggest going there first before you spend the big bucks on any kind of doctor that specializes in fluoroquinolone toxicity, which are few and far between. So I'm trying to see what I should start with. So Reddit and his online reviews, the online reviews for Regenerative Medicine LA can be very mixed. And the reason I'm apprehensive about making this review is because he knows what is being said about him online. He's aware of the Reddit, the Reddit threads that are talking about him. He mentioned this in my appointment with him. So he knows the things that are going on, that are being talked about or being said about him. And I kind of want to clarify that because on the one hand, I do agree with some of the things that are being said. On the other hand, I'm not sure where some of the other things are coming from. Maybe other people have had different experiences, but I will tell you my experience with him. So he is very expensive. I think it was like over $1,000 just to have like an appointment with him. And then the IV treatments are extremely expensive. Now, I do think the prices are overinflated, but he also has his office. I think it's like West Hollywood, Beverly Hills area. That's going to be an expensive area no matter what. So just, I can't say, he's overcharging when I'm pretty sure the real estate there, just having an office there. I think he recently either moved to a bigger office. I don't know if I had gone to that bigger office or if they were in the process of getting to a bigger office. But again, he's paying all of these bills, because this is his own private practice. He has a staff of several people, so it's going to be expensive as well as the area. So I can't really say like, well, the prices are overinflated. Yeah, the prices are way too expensive. You can get an IV somewhere else for cheaper, but you also have to consider the area, whatever he's paying for that office, and all of his staff. His staff is very, very nice. They seem a little scared, which if you've ever been to any of these sort of specialty doctors, their staff always seems kind of scared and on edge. These doctors are just very stressed out all the time. And a lot of that stress trickles down to their staff. But they were all very nice, and very, very kind, very accommodating. So you have to sign a bunch of paperwork before you see him. Most of the paperwork is just to protect him legally because he's doing IVs. I'm not going to detail all the treatments that he does. To be honest, you don't even know what's in the IVs. You will not be told what's in the IVs that specifically treat fluoroquinolone toxicity. But the paperwork that you sign does detail, I think, a few of the things that he does there, and you have to sign off. You have to sign off. Basically, the paperwork says this isn't guaranteed to help you. So just take that for what it is. None of these treatments are guaranteed to help you. So he's well aware that there is a failure rate. And that's, that's what a lot of people discuss in the Reddit thread, is that there are people in there that say, I did the treatments, I went to him, it didn't help, or it made me worse. It's there in the paperwork and you sign off on it. So you can't get your money back. You can't take him to court. You can't do any of that. So just be aware of that when you go in there. There is also a lot of talk about NDAs. I did not have to sign an NDA. I'm not sure where people are getting that from, but I also did not receive fluoroquinolone toxicity treatment. I did get, I think, a magnesium IV, which was like very expensive. I think that one was also like $1,000. Magnesium IVs are not $1,000. You could get it somewhere else for less. But he didn't have me sign an NDA. I looked at my paperwork, and none of it is NDAs. A lot of it is just, again, you signing off that if the treatment doesn't work, you can't take him to court. If something goes wrong, you can't take him to court. You guys have to just settle it, outside of court. And he's not making any promises. Now, here's one thing. Since I just went through the paperwork, there is a paperwork because of COVID. There is a paper that you have to sign off saying that you can contract COVID. That there is the risk that you can contract COVID in his office, or that you can give him COVID. And so you have to sign off on that as well, saying that, you're okay with taking that risk. Here's the problem. He does not permit his patients to wear a mask once they go in and see him. That was one of the things that I did not like. To be honest, I trust that he's in good health when he's there. But in light of the form that I had to sign, that I didn't even realize I signed, I probably was just signing everything without even paying attention. But I was asked to remove my mask once I went into his office. I was allowed to keep my mask on while I was in the waiting room. That was not an issue. But the staff did notify me to take off my mask before I saw him inside his office. Again, I don't think he's going to work sick. I trusted that everything would be fine. I don't think he would, especially because, I don't think he would put himself at risk like that either. He's not an idiot, right? Because he does have that form saying, you're signing off on the possibility that you could get sick in my office, but I can also get sick in this office as well. So again, this is the one thing I'm going to say. He's also an RFK fan, and that's why I decided to make this video now that RFK is sort of in the, in the larger conversation when it comes to our healthcare in this country. He's had RFK in his office. He's taken pictures with him. He was an RFK guy. That's fine, right? I don't care. There are some people that get very upset about politics being brought into medicine. I don't like it. I think there are standard, protocols. Most of the other doctors that I see, wear masks when I'm in there with them. But I also trust that doctors aren't going to work sick because they are aware that they can get their patients sick. But keep that in mind, that you're signing off on the possibility that you can get sick. And I have a feeling that might be the reason why he has that form, because, you're asking patients to remove their mask before they come in and see you, which, again, I don't have an issue with it. But, if that's something that bothers you, and again, because politics are kind of involved here, you know who he supports. There are people that want a doctor that shares their politics or shares their political views. I guess when it comes to medicine should be apolitical. Unfortunately, it no longer is. So if that's part of your politics and part of your beliefs, then he's your guy. If it's not, I would be very careful. I would approach with caution. I wasn't going to fight with him. I wasn't going to argue with him or his staff. His staff was very kind and accommodating. They let me keep my mask on until I went inside his actual office. So, I really, nothing happened to me, so I was fine. I'm looking down my list here. So he's nice enough. He's a nice guy. The only thing that he doesn't like is to be challenged. And again, like I said, he's aware of what's being said about him on Reddit. He told me himself. And I think, we were having a pretty good conversation. I think he's a smart guy. And there was something that I said, I guess, that sort of, he took it as a challenge or something, and he snapped at me. He doesn't like being challenged. He doesn't like being questioned. You're also not going to know what's in these IVs, because I guess it's like a special formula. I don't know. So you just have to tread very carefully with him. He does have an ego, and he doesn't like being questioned or being doubted or anything like that. Here's what I recommend if you are planning to see him. If you have fluoroquinolone toxicity, which is his specialty, I don't know why you would go to see him for any other reason besides that. Do I think he's knowledgeable in it? Yes. I did find him to be a helpful resource, albeit a very expensive one. But what I would recommend is going to the Reddit thread and trying the things that they recommend there first, getting your supplements at, at a supplement place, or at Sprouts or Whole Foods or wherever, and trying the supplements first, right? I think magnesium and magnesium CoQ10, glutathione, those types of supplements you can get through Amazon or wherever, and those are sort of like the base protocol for fluoroquinolone toxicity. Magnesium, I think, is one of like the essential ones. There's some other ones, but again, you could go to the Reddit thread and you can find out there. If you've tried that, doing that, pacing yourself at home, trying to, make accommodations for yourself. I don't know if you're working or whatever, that might, again, some people that have jobs and that really need to get back to work right away may be desperate to find a quick fix or a quicker fix, and you may want to visit him, especially if you have the money for it, and you need to get back to work. That might be the solution for you. But I would say start on your own, go to the Reddit thread. Also, I would only see him if you have a straightforward case of fluoroquinolone toxicity. Meaning that before you took the fluoroquinolone antibiotic, you were fine, you were healthy, you had no other pre-existing issues. I had already a bunch of pre-existing problems prior to seeing him, so I was like, I don't know what's in the IVs. I react to everything. If you have that kind of problem where you react to a lot of things or you don't tolerate a lot of things, this might not be a good idea because you don't know what you're getting. If you've already tried some of the things from the Reddit thread and it's made you sick and you're not, it's just too complicated, you might not want to spend the money on him, because I think a lot of the stuff that you find in the Reddit thread, you're going to, is stuff that he uses. He's just not letting on to that. If it's a straightforward case, you took a fluoroquinolone, antibiotic, and then all of a sudden you started having all these problems with your tendons, maybe fatigue, that kind of thing, and a lot of pain, that's probably when you would go see him. Because that's what he deals with. He deals with fluoroquinolone toxicity. He was a healthy guy prior to taking a fluoroquinolone antibiotic. He took it. He had all these issues. He figured it out, by doing his own research, and then he got better. Why? Because he was previously healthy. He was also very young as well. So that's kind of what I would recommend. Also, if you're poor, you probably can't afford him anyways. I don't have a lot of money. I went and I was like, I have a certain amount of money that I'm willing to spend on this. And I also hadn't taken the fluoroquinolone. I think I had taken one pill of the fluoroquinolone. And so I hadn't completed the course. So it was like, I don't know what the outcome is going to be. So I was kind of prepping myself for it. And to be honest, he can possibly prep you for it. He will tell you not to take it. He will say, don't take the fluoroquinolone, don't do it, because he's very much against them. But if you have to, because I had really no other options, then he might be a good guy to visit just so that he can give you tips. He's going to tell you not to do it, but you can also get some tips on certain supplements that you can start taking prior to taking the fluoroquinolone that may have some kind of protective, benefit. But again, if you have pre-existing stuff, I just don't know if I would recommend spending this much money on these treatments. Again, if your politics align with his, then I would say go ahead and see him. If your politics don't align with him, do not go in there looking for a fight. Do not go in there trying to challenge him and trying to correct him. Just don't go. That's a philosophy that I have, because I have had other doctors that have different politics. And if I'm choosing to spend the money on them and choosing to see them, that's on me. I'm not going to go in there and start arguing and trying to prove a point. You're not going to prove a point. Just don't go if you're going to have a problem with their politics. He does post videos. You do have to sign off on whether you're going to allow him to post a video of you, I guess, if the treatment is successful. He usually only posts videos on his patients that have had success with his treatments. He's obviously not going to post videos of people that aren't having success with that. You will find those testimonials on Reddit. I recommend that you go look at them before you see him, just so that you know the possible outcomes. But just know that if you are a success story, you may be put on display on his he has an Instagram. I think he has Instagram, Facebook. He has all the socials, so you might want to look for him there as well. These are just my suggestions. It's a lot of money, and the reason I make videos like this reviewing these places is because I know people are dropping a lot of money on these treatments, and it's not fair, especially for those of us that don't have this kind of money. I just don't think that it's fair. You do have to sign off. You do have to sign off that you're not going to, sue somebody or take them to court, which sucks, especially when you're dealing with experimental stuff. But the doctors do this to protect themselves and to protect their money. So I'm here. My job is to protect you and to protect your money. I'm spending this money so that you don't have to. I'm putting myself through all of these treatments and all this crazy stuff so that you don't have to, so that you're well informed before you go see these people. Because let me tell you, I have spent probably well over $50,000, dollars seeing doctors like this, getting treatments like this, doing all the crazy stuff. And, I've been disabled. I'm living on Social Security, and I know a lot of you are. A lot of us are desperate to get better. They will try to sell you. They will try to sell you on these treatments, whether you have fluoroquinolone toxicity or not. They are going to try to sell you on these treatments. And, just listen to what I'm telling you in this video. Listen to my suggestions, the criteria that I have for whether you would be probably a good candidate for this, for his treatments or not. Because you don't want to blow all that money. It's very expensive. It's a lot of money. So that's what I have for you guys. If you have any questions, like I said, I'm not a doctor, but if you have any questions, you can leave them down below. I don't think this video is going to get me into any trouble. I'm not saying anything. I don't think he's a con artist. I don't think he's a con artist, but again, he's making money, right? So that's what I have for you guys for today.